Well, October is National Breast Cancer Awareness Month, so joining me today is Dr. Douglas Andersen from Portneuf Medical Center. Dr. Andersen, good to see you again. We appreciate you being here.
Thank you. Good to see you here, too.
So first, let's just talk about the importance of Breast Cancer Awareness Month.
Yeah, so breast cancer is one of the most common cancers there is. I went to church the other day, and I figured there were about 100 women there and 100 men. That means 1 in 8 of those women will end up with breast cancer in their life. So about 12 to 15 of those women in my own congregation will end up with breast cancer, and I'll probably end up seeing them in their lifetime. So super important just because of how common it is.
And what are some of the, the symptoms for breast cancer, signs that women can watch for to know to go get checked?
So breast cancer often, thankfully, with mammography, we can catch it before you have any symptoms, which is the best time to catch it. But otherwise, any sort of lump, especially if it's growing, but even if you're just feeling something that you aren't sure was there before, any sort of discharge, pain, the first spot that we can see it besides the breast is in the armpit. So if you're getting armpit swelling or that sort of thing, that could also be a sign.
Okay, and let's talk about the mammograms, the importance of those and getting your screenings.
Yes, so super important. At age 40, screening should start unless you have strong family history of breast cancer, and then you can start even earlier than that. And you get that done yearly. And again, that can catch a breast cancer really early with super good prognosis, super good chance of being cured of it, as opposed to being stuck with it for the rest of your life.
And in today's world, we have a lot of advanced technology, so there are a few different options for women to get those mammograms, to get their screenings.
Yes, so we have mammogram screening here at, if you call Portneuf at 239-1500, they can get you set up for mammograms, but there's also a mobile mammography unit, and that goes to some of the outlying areas here. It does go to Idaho Falls, Arco, Malad, Soda Springs, and some other areas. So if you do live in an outside community, you can check and see if they're coming to your community, and then you don't even have to travel.
Okay, perfect. And if you are diagnosed with breast cancer, what are some of the treatment options available?
So it is a team approach, and we are very lucky for a smaller size community here. We have a very excellent team. We have 3 fantastic female surgeons that do most of the breast cancer surgeries, including reconstructive or plastic type of surgery. So there's the surgery side of it. Often we will do radiation to help reduce the risk of breast cancer. And then there's a hormone blocker type of treatment that you can go on afterwards often. And I end up being kind of the quarterback for all of that, make sure everybody gets through all of it properly. And then again, kind of going forward, making sure we're continuing to follow you.
Very much a case-to-case basis.
Absolutely it is, yeah.
Okay, anything else that you would like people to know as we start Breast Cancer Awareness Month?
We are having Break for Breakfast coming up this Wednesday. And so that's part of the awareness month. It's at about 6 o'clock in the morning, just south of the hospital. We get a lot of people coming through. You pick up a little packet with some little gifts and information about breast cancer awareness, and that goes until 8:30 or so when we run out of those packets. So if people want to come on by, they can come and see that. I'll be there too.
I was going to say, we'll both be out there bright and early, so stop by and see us. Be sure to get those packets. Dr. Andersen, thank you so much for joining us. We appreciate it.